Hi, I am Danielle Archer, and today I will be giving a persuasive speech on cervical cancer. The general purpose of this speech is to convince you, the audience, that cervical cancer is very deadly and prevention is most important versus treatment. Specific purposes: upon completion of my speech, you, my audience, will know what cervical cancer is, its causes, what treatments are available, and the importance of vaccinations. Cancer is known medically as a malignant neoplasm, which is a broad group of diseases involving unregulated cell growth. In cancer, cells divide and grow uncontrollably, forming malignant tumors. The cancer may spread to more parts of the body through the lymphatic system or bloodstream. There are over 200 different types of cancers that are known that affects humans, and this speech will focus on cervical cancer. 7 years ago, I heard the dreaded words from my doctor: "Your results of your pap smear came back abnormal." I, at 20 years old, did not know what that meant, but I immediately became terrified. After further testing, a colposcopy, my mind was put at ease with results coming back cancer-free. This was only the beginning of a long, winding road to my scare with cervical cancer. At that time in our society, cervical cancer was not the forefront of discussions, and a vaccination for preventing it was unheard of by most. After years of biannual pap smears and colposcopies, I was staring down mutated cancer cells in the face. In the end, I had to do a LEAP procedure because my colposcopy came back with positive mutated cells that could possibly be precancerous. I started the human papillomavirus, HPV, vaccine to prevent contracting any further strain of the virus. After enduring years of testing with abnormal results, I have had 2 years of negative results, and I am now considered normal. The cervix is the lower part of the uterus that opens into the vagina. Cervical cancer occurs when abnormal cells on the cervix grow out of control. Most cases of cervical cancer is caused by the human virus papillomavirus, or HPV. The changes in a cell at first are called abnormal, not cancerous. These changes, however, are the first step in a series of slow changes that can lead to cancer. Dysplasia, which is an abnormal growth of cells, is the next phase, and it is precancerous tissues. The tissue can be removed or destroyed without harm to the healthy tissue, or a hysterectomy might be needed in order to prevent cervical cancer. If these precancerous cells do change into true cancer, they spread deeper into the cervix and or into other tissues and organs. Cervical cancer can be prevented if precautions are taken. Women that take part in sexual activities should practice safe sex by limiting partners and using protection. Have regular pap smears, which always shows cell changes before they turn into cancer. And if under the age of 26, get the HPV vaccine, which protects against the 2 types of HPV, HPV 16 and HPV 18. Worldwide, there are an estimated of 529,000 new cases of cervical cancer and 275 deaths per year. In the United States, roughly 11,000 cervical cancers are found annually. Most cases are found in women who have never had a pap smear or didn't have one in the last 5 years. Treatment for cervical cancer after the diagnosis may include surgery, which can include a hysterectomy and removal of pelvic lymph nodes, chemotherapy, and radiation therapy. The hysterectomy is the most extreme treatment of them taking taking the ability to have children away from the victim. But if the cancer is detected early, another form of treatment or a combination of treatments will and can be used. There are new treatments and ways to diagnose cervical cancer being sought after through research. Researchers are looking into new ways that are less invasive for the patient. Sentinel lymph node biopsy would exclude the removal of lymph nodes via surgery. Research is still being conducted on improving the HPV vaccines. Targeted therapy is a new drug that targets the changing cells, the precancerous cells, and this is less severe than chemotherapy. Hypothermia, in addition to radiation, is believed to stop the cancer from returning and allowing the patient to live longer. To conclude, there are many drugs and treatments being sought after in the prevention and treatment to eradicate cervical cancer and the disaster it causes for its host and the host family. I urge parents to vaccinate their children and ensure that all shots are given or received in a timely manner stipulated. Prevention is always better than treatment. Although more focus is placed on females, it is just as important for boys, males, to be vaccinated against HPV virus. I have experienced a close call with cervical cancer. The course of action I had to take was very severe. It was to prevent full-blown cancer was painful, traumatic, and very much preventable. I encourage everyone that is hearing my voice to take the necessary precautions in protecting themselves or their loved ones from enduring any pain or loss from contracting this potentially deadly virus that leads to the deadly disease, which is known as cervical cancer. Thank you. My references used were Wikipedia, WebMD, James Holland Free Cancer Medicine, the American Society of Clinical Oncology, and the Cancer Organization. Thank you.